We're going to be talking about how you stress or test the lateral and medial ankle ligaments now. And so the lateral ankle ligaments are your ATF, your CF, and then your PTF. So ATF is your anterior talofibular ligament, CF is your calcaneofibular ligament, and your PTF is your posterior talofibular ligament. And these all together are considered your lateral ankle ligaments. Remember, these are different than your tibiofibular ligaments, which are considered part of your high ankle sprain. If we talk about a lateral ankle sprain or an LAS, we're only talking about these three down here. The ATF is the most commonly injured of these, and the most common mechanism to hurt that is in plantar flexion and inversion, so like stepping on a foot or something like that. And so the way that you do it, and remember, you're going to stress a ligament in the same way that they would hurt it. You want to find subtalar neutral, so just a very little bit of plantar flexion. You're going to put your fingers on their talar corners or anterior talar corners, and as you bring them back and forth, you should feel them come back and forth, and you want to make it so that way you can feel them pretty evenly to the right and the left. And then what you're going to do is take your hand and put it across their distal tibia, because you're going to allow the talus to slide, cup their calcaneus in your hand, and then you want to pull their talus straight towards the ceiling, so anterior translation. So you're going to block that distal tibia, cup the calcaneus, and then pull straight up to the ceiling as you're doing this. She has no sliding, a very firm infeel. Have you hurt this ligament before? Have you sprained this ankle?
Yeah.
Oh, she sprained the other side, so that's why it's stopping so good. So you guys can maybe see that she's sliding a little bit, and that's normal, but she doesn't have pain, she has no mechanism. And so most people have a little bit of give, because if your ankle was so solid that it didn't move around, we would hurt our ankles and our ligaments all the time. So they do have a little bit of stretch. So that's how we do the anterior drawer that assesses the ATF. Then we look at the CF, that's the number 2 most common ligament that we hurt. And that comes from your distal fibula down to your calcaneus, because that's what it's named for, right? And our mechanism to hurt this ligament is just straight inversion, so coming straight in. So again, you're going to put them a little bit kind of in a neutral foot, not quite as much plantar flexion. Find that talar neutral, and then you're going to hold basically in the same place. I tend to hold right around their malleoli, and then you're going to grip their calcaneus and then really just rotate it straight to the inside. So as you do this, I am just taking her heel and coming straight in with it, just like that. And so as you do that, it's good to, I usually put my index finger right on her calcaneofibular ligament, so that way I can feel it get tight as I do this motion. And if they report pain, which she is not, and or it's going to keep going and going, like I've had people where they've totally torn them and their ankle just keeps like it's going to come off to the inside. Now you are going to have bony blocks on the medial side, so it's not like the whole ankle is just going to fall off or anything. But the Talar tilt, or TT test, is how you are going to assess the calcaneofibular ligament. There technically isn't a test to just isolate the PTF. There's not like a posterior drawer or anything, but typically if these other two are painful and positive, and this posterior ligament is also painful as you're doing those, and it's painful to palpate, the chances are that they also probably hurt that ligament. If you hurt all 3 ligaments together, that's called a grade 3 lateral ankle sprain. So I know we talk about individual ligaments getting hurt, and so a grade 1 is less than 10% of the fibers being torn, a grade 2 is less than 50%, and a grade 3 is 50% or more of the fibers. And so that pertains to each individual ligament. The way that we talk about lateral ankle sprains as an injury together, so talking about the 3, is a grade 1 is only the ATF, a grade 2 is the ATF and CF having some form of damage, and a grade 3 is when we have the ATF, the CF, and the PTF all involved, okay? So those are important to know. And then we also have the deltoid ligament. We talked about that in palpation and anatomy, and that's a really big ligament. There's 4 bands to it, and it's on the medial aspect of your ankle. So here on Brooke, it's running this whole entire area. It's very, very thick, and it gives you really good protection on the medial side of your ankle, and it prevents you from going out into eversion, which is really good. We don't want to do eversion. The other thing, remember, we talked about is this lateral malleolus hangs lower than the medial malleolus. So between the deltoid and the lateral malleolus, that really prevents us from moving into eversion. However, it is possible for us to do that, and a lot of times when we do see that happen, we're going to see distal fibular fractures, or sometimes higher up in the leg, syndesmotic injuries, or interosseous membrane injuries. Remember, those words are synonymous. And also deltoid injuries. We also see these when people dislocate their talocrural joint. So basically, when we're going to do the lateral talar tilt instead of the medial, you start just the same as we did to assess the CF, and then instead of bringing it into inversion, to do the medial talar tilt, we're going to go out into eversion. So we're just rocking that heel straight to the outside. Now, we can also do 2 other tests that assess the integrity of these lateral and medial ligaments, but also the ligaments that are deep inside the subtalar joint. And these are called your medial and lateral subtalar glide tests. I would say that the medial is worth doing, the lateral isn't, because the distal fibula hangs too low and it's going to block your ability to really move well. But again, the way that you do that is you're going to put them back in neutral, talar neutral. And then what you're going to do for the medial is you're going to take your thumb and you are going to put it just, here, actually, let me bend this knee for me. For this, I'm going to flip my hand so that way you guys can see what I'm doing. So I'm going to take my index finger and I'm going to put it just distal to her medial malleolus. See how that is, just like that? So I'm blocking her talus. So put her in neutral, block her talus so that way it can't slide with me, grip her calcaneus, and then I'm blocking this. So then I'm actually taking her calcaneus and I am simply, oh, she's in too much plantar flexion, sorry. And I'm bringing her talus straight to the inside. So medial translation straight at you guys in the camera. That is the medial subtalar glide test, and that can somewhat assess the lateral ligaments. It mostly assesses those deep ligaments that sit inside the subtalar joint. If they did hurt the deltoid, this is going to be painful because you're putting your finger right on it. But if they did have some damage to it, that could happen. You can technically reverse it and do a lateral glide, and again, your thumb, I'll flip this around. If I do that, you would block just distal to the fibula then, same position, and then take the calcaneus and glide straight towards the wall. So notice I'm taking your calcaneus and I'm moving straight to the wall. There should not be a ton of motion in this. You're gonna get a little bit, but if this is positive, they're gonna have a pretty unstable ankle and foot, and they're gonna feel pretty loose. It's not super common to hurt these deep ligaments, but it is possible for them to hurt these ligaments. So knowing the subtalar glide test, whether it's medial or lateral, is going to be helpful to be able to assess those deep ligaments and the integrity of their joints that are going on in this ankle joint.